Hey everybody, it's Dr. Ryan from Infinite Wellness. One thing that I wanted to show that you don't really see out there, at least by anybody in the since 1980 or before that, is what an adjustment really is. It's super simple. The idea is to make sure that the body is aligned, make sure that the spine is aligned so that the nervous system can do what it's supposed to do. So if there's pain, the nervous system knows that it doesn't want to be in pain. So if you line everything up properly, the body will heal itself. So it's very simple how we do this. This is just one of many ways to adjust the spine, but this is the way that we do it here at Infinite Wellness Chiropractic. We always want to check the balance of the spine, and the easy way to do that is to look at the feet to see if there's a difference in leg length, because that tells us there's a difference in something going on in this system. All right, and so with Ethan here, our great little model here, he is running a little bit high over here. The leg is coming up. So one way to adjust the spine, again, there are over 200 different ways that I know of to adjust the spine. So one way is a drop adjustment. It's very easy. Just get in here and you use the table to actually do all the work. So that loud noise is not me touching him, it's actually the table making the noise. So nice, easy drop adjustment to make sure that the spine is moving better and it's aligned more properly. Everything's looking better there. All right, and then we move up. And some doctors work from the head down. We just like to work from the base up. And so you want to, or I should say, I like to work from the base up. We just move up the spine to try to find any areas that may, again, be rotated. There may be some edema or something around different spinal joints. We try to align those joints properly, again, to make sure that the nerves are flowing to where they need to flow to, whether it be muscle or organ systems or anything. That's why chiropractic can help with so many different things. It's because those nerves not only work on the muscles and the joints, they also work on the digestive tract, the heart, the lungs, everything. So we just want to make sure everything's working good. Sometimes it's just a quick little thrust into certain areas to make sure that the area is moving better, to make sure it's aligned properly. So we make it in nice and easy, very easy stuff. And a lot of chiropractors, including myself, we take care of children all the time. Babies, I mean, you'll see when you come in this office, sometimes babies are in here getting adjusted. And you know it's pretty easy to do, or not easy to do, but easy on the kids, because if they're sleeping, some of them won't even wake up. So that's how easy it is on them. They don't even, it's not just, there's no discomfort. It's not uncomfortable. So what we're going to do, and you can even do a drop adjustment on the cervical spine. So some of you that are scared about getting your neck cracked per se, again, there are a lot of different ways to adjust the spine. If that's something that you're extremely scared about, just let us know. Most chiropractors have multiple ways. One way that if someone's really nervous or they have a lot of arthritis or some surgery that they've had in the past, infusions, there are different ways to adjust the spine. Sometimes we'll use something like this, which is a little activator. We use this on babies. You can set the tension different ways to find different areas. You get in there, boom. You try to make sure. It may take a couple times to get it exactly where we want to go. There's a whole technique based on this guy. So we just find the areas that need adjusting. And so I'm also going to have Ethan lay on his left side because he's got some rotation in the pelvis. So what we want to do, or at least how I do this, is it's going to be a very light adjustment to try to get this rotation out of the spine. Good, nice and easy. And have him lay on his back. So as you can see, there's been no screaming, no craziness that some of you may think of when you think of chiropractic. It's super simple. And I mean, I'm 6'6", 200, I'm not going to tell you that, but 225, and it's nice and easy. I'm a big guy, and it doesn't have to be a hard adjustment. Sometimes some people get adjusted a little bit harder than others. Sometimes we do it very, very light. And again, it depends on the person. I'm not going to adjust an 80-year-old woman like I would adjust an 18-year-old college football player. So and then one thing that a lot of people are always scared about is adjusting the cervical spine. They're always worried about, oh, I've heard this, that, and the other. Well, that's all basically untrue. Can things happen? Absolutely, things can happen. But this is a very light type of adjustment. This is not a violent type of thing. It may look scary, but I can assure you, I mean, I do this on my little 5-year-old daughter, so this is not anything that's going to harm anybody on a regular basis. If you're prone or already having something going on, a lot of people come to chiropractors because they're having headaches, and that's the first symptom of some of the issues that may arise for some of the folks that say whether it's a stroke or something like that. But again, anything can happen, but it's very, very rare. You're more likely to have a stroke leaving or having your, like I was talking to my mom, having your hair washed in one of those little things where you put your head back, not at a chiropractic office. You're actually less likely through the research to have any issues with that from this. So just to actually see how this works, it's very, very simple. You just find the areas that need to be moved and you just move them. And you just get in there, very easy. And as you can see, it was super simple. I'm not cranking his head around or anything like you see on television or can imagine from some crazy story you may hear from someone out there in the world. And that's basically it. The whole idea is to line that nervous system, or line that spine up so the nervous system can do what it's supposed to do, so the body can operate optimally, so it can move properly, so it can be efficient, so everything can be innervated as close to 100% as possible, so that way that the body can heal itself. And that's really what chiropractic is all about. And again, when the body's working at close to 100% and that nervous system is working as close to 100% as possible, the body will heal. And that's why so many things are helped with chiropractic. Everything from indigestion to heart issues to lung issues, asthma, allergies. I mean, you name it, even headaches. I mean, you name it. You name the disease and is absolutely helped by chiropractic, because chiropractic gets the body functioning better. Just like eating right, just like exercising properly, just like having positive thoughts. So have a blessed day. Hopefully that made this a little more less scary for some of you that are out there and worried or thinking about a chiropractor or thinking you never go because you're scared. It's very simple. There are a lot of ways to do it, and all you got to do is tell me or your chiropractor, wherever you're at in the world, that you know, if something makes you uncomfortable, they can usually do it a lot of different ways to make sure you're comfortable but are still getting the job done and getting your body healing properly. God bless. Have a great day.